Hello, everyone, and welcome back to the Empower Podcast. This is a podcast run by healthcare professionals for healthcare professionals with an overall goal of raising transparency and awareness, with a continued goal to have legislation passed in the state of Colorado and throughout the whole United States, mandating employers to provide employee wellness programs. At Empower, we believe in the power of community, diversity, and inclusivity to create positive change and improve society. Our podcast aims to amplify those voices that often go unheard, featuring interviews with individuals and organizations who are truly making a difference in their communities and beyond. Through thought-provoking conversations and inspiring stories, we're going to continue to strive to raise that awareness and promote action towards a more equitable and sustainable healthcare realm throughout the world. Join us as we explore these new perspectives, challenge assumptions, and work towards creating a brighter future for all. If you have any ideas of any healthcare professionals or community members that would benefit from this podcast or even being a guest, please let them know. And they can contact us, even with feedback, at the Empower email. That's the word Empower. That's Echo Mike Papa Oscar Whiskey Echo Romeo Alpha 1 at proton.me. Today, our guest is Billy. Hi, Billy.
Hello.
And Billy's coming us to, where are you coming to us from?
Ohio.
Ohio. We encourage our listeners to share their experiences anonymously. And if you prefer, again, we have that email. We're on various platforms. We actually just also expanded onto Rumble due to the ongoing things that are going on with YouTube and censorship. So we'll see what comes out of that. And again, Billy, we're very thankful to have you here. Thanks for being here.
Glad I can be here.
So everyone, sit back, be yourself no matter what, and get ready to be empowered. All right, Billy, we're going to go overall start here with the overall, your thoughts on the integrity of healthcare for you.
Yeah, so I can mostly speak for the behavioral healthcare side of healthcare. So mental health, behavioral problems, addiction, things like that. And one of the biggest struggles that behavioral health is having right now is there's actually been a double in reported mental health illness since 2019. In fact, the National Institute of Mental Health estimated about 20% of U.S. adults were living with a mental illness in 2019. But since 2020, the people reporting mental health issues went up to 40%, and it's been increasing from there.
Wow.
One of the major issues that people are having is because of the extra demand for behavioral health and mental health problems and people to address them is a significantly increased workload that's led to a lot of burnout for people in the behavioral health field. In fact, other studies show that since 2020, the workforce for behavioral health is only about 60% of what it used to be.
60%?
Yes. And because of that, it's really causing a lot of issues as far as workforce. Some data from the Kaiser Family Foundation was that about 47% of the U.S. population in 2020 was living in a mental health workforce shortage area, where there were about half the country was living in an area where there was not enough mental health clinicians in the area. And some states needed up to 700 more practitioners to remove the designation of being a shortage area.
That's whole U.S. That's not just Ohio where you're at, Billy, right?
Correct. That's the whole U.S. There are some states that require up to 700 more practitioners.
And you're a practitioner yourself.
Yes.
Wow. I appreciate you coming out too and taking that stand to want to talk about that and have that kind of a conversation, because sharing is honestly how we win, in my opinion, as a society, is just being able to share and talk about these things. And wow. And thank you for presenting the statistics for this too. I mean, I have yet to have somebody, not to put down any other past guests. I appreciate all of the guests that come on here and what they can offer. But to be able to have that here, that's a gift. And I really want to acknowledge that from you, Billy, so far.
Absolutely.
I guess for me, going to the overall question, and before we hit it, I want to ask myself already, and this is what I do at a part of the show, is I say, Brett, does this guest make you feel empowered? And Billy, you for sure certainly make me feel empowered. So, and I guarantee you from all the listeners, I don't mean to speak for them, but from what I've heard from feedback, that's wow. Okay. Okay.
Yeah. So those in the behavioral health field definitely know that you are not alone. This is a nationwide issue of an increased workload with a decreased workforce.
And then even for that, you being a part of the patient experience is what I call it. That has an influence not only on when people come into the hospital too, or they are admitted. That's all still part of the overall patient experience. And to see that, I guess there's, in my opinion too, from what I'm seeing, is there's a lack of integrity in that. We're all dependent. It's all like almost like Gestalt, right?
Absolutely.
Some of the pieces all working together, right?
Absolutely. And when we think about how much mental health affects physical health and vice versa, they really are interconnected. I mean, most hospitals even have licensed social workers on site to address pediatric issues where there might be allegations of abuse, to provide grief counseling, things like that. And they're also very understaffed.
I know that I just got done visiting some people that I know in Wisconsin, and when I was there, they're in one of the, I'm going to put it out, but it's a area of Wisconsin that has literally only one clinic, and they have variable hours, and then what was the other one? And then after that, I think, it's just, I don't know, the overall person, when I talked with them, what it came down to, Billy, was they were talking about availability to care, and then availability with care, and then also we got into the topic of timely care and being able to have that provided, and how even that overall delay that can happen is that overall influence on not only the loved ones of those who love a patient, or if they are themselves the patient, and then their loved ones experience from that and seeing that, and then the overall influence, big picture, what I see is then with society.
Absolutely. You brought up like timeliness of care.
Mm-hmm.
I have seen places that have wait lists of up to 2 months to begin addressing behavioral health problems. Mm-hmm. And even other places outright turning away clients or referring them out because they're at capacity of what they can handle.
Wow. And so they don't discount the overall quality that they can provide versus just the numbers. You know what I mean? I guess quality over quantity. Excuse me. Yeah.
Well, that's also debatable because of the quality. Because of the quality, yes, a lot of individuals have to get turned away for mental health problems, mm-hmm. but because of the quality and the quantity of each clinician's workload, several are experiencing burnout.
Mm-hmm. We have to take care of those who take care of the others, correct?
Exactly. A lot of times behavioral health clinicians will talk about past traumas, talk about fighting substance abuse and emotional health, and at the detriment of their own mental health. And I think one of the confusing things is that you have to have a mental health problem. It's a common misconception that you have to have a mental health problem to have mental health, right?
Oh,
but
yeah.
Everyone has mental health just as they do physical health. A person can have physical health without having a physical health problem, the same way they can have mental health without having a mental health problem.
The whole connection of the mind and the body, and not forgetting about the one over the other, right?
Exactly.
Wow. Because they work in tandem too. I mean, in my opinion too, I've said it before too, the body keeps count. And I think if one isn't taken care of, it shows in the other, and in whatever way it comes out. and whatever comes out, and that's what we're kind of able to, what we take on as practitioners. And then with that, we being like the patient, we're only human. So like you had mentioned too, looking out for the overall provider as well. Cause I guess even in my line of work, you see the burnout nurse burnout healthcare professional, who are, they're 2 to 3 times more likely to abuse drugs and alcohol than the general public. Literally, it's kind of, at sometimes I feel even the blind leading the blind, to the point where if you're not taking care of one, the other one's not really honestly going to be taken care of either adequately and to the point I think that they deserve. And
absolutely.
Yeah. And I know.
And
go ahead. Yeah.
Go ahead.
No, you go ahead.
That's what I really mean as far as like the quality of services, because so many clinicians, so many nurses, so many people in the health field in general are experiencing such high levels of burnout, and especially in the behavioral health side, compassion fatigue, that they're not developing or providing the same quality of services they were before.
So, Billy, if you could you tell our listeners a little bit about what compassion fatigue is?
Yeah, so compassion fatigue is really early signs of burnout. As I mentioned, like behavioral health will a lot of times hear about trauma, hear about emotional distress, and an essential part of counseling and behavioral health is having empathy for those individuals. Compassion fatigue is when it feels like there is no more empathy left to give.
Okay.
They're blowing up on a dementia patient.
Yeah, they could. I've seen that. I guess that could be. Yeah, I guess. Yeah, I've definitely seen that in my line of work too. I had another listener here who's in a vehicle with me because I just recently traveled, but they're also a healthcare professional, and I guess they've also seen it. They just mentioned it. Would you like to be referred, extra guest? Okay, guest 2 is what we'll call this person, for sure. Thank you for your input, guest 2. I'm going to go back to Billy here. So it was more the overall, guest 2 had shared the overall ability of burnout healthcare professional and their overall reaction potentially at the bedside, and how that can actually influence the overall patient experience. I think that's where we were.
Absolutely.
Okay, gotcha. All right. So then, with that, was there anything else you'd like to say, in your opinion, is happening in healthcare? Any past or present incidents that may have happened that could have been handled better, or that were handled well, or I guess, yeah, or ways that you're looking to continue to give back, knowing what it is that you know of what you have said is happening, in your opinion, in healthcare?
Yeah, so I guess as far as how it can be addressed and how I've been trying to address it with my staff is making sure they're going home on time, making sure they're coming in on time, not early to finish up work or anything like that, and really making sure that there are healthy professional boundaries that help protect their own mental health.
And having a willingness to speak up about those.
Yeah, just having a willingness to set those and make sure like they know it's okay to leave when the clock ends,
I get that. Wow. And at least to hear that, and I guess, can I ask you there, do you work management then, from what it sounds like?
Yeah, so I'm a clinical director for a behavioral health agency.
Billy, you stepping out of the stands where most people are and coming onto the court and being able to say that truly makes a difference. And I really look forward, and I want to say you're definitely a prime example of what even I look for in management. And I've seen it. So, and you continue to not only advocate for yourself first, because you have to take care of yourself before you can take care of anybody else, but then also for those who are helping you take care of others. Wow, because I know probably, and I don't want to speak for you, but actually I'm just going to ask you, Billy, if you could split yourself into a million pieces and help out as many people as you could, would you do it? Without any consequence? Okay, that's all I'm saying.
In a heartbeat.
Yeah, but you find the ways that you can through a good team to be able to still have that happen to the best of your abilities, and I feel that. Definitely.
Absolutely. And I mean, to me, I guess at least good management is almost like the ability to do that, right?
Mm-hmm.
Because not only am I helping clients through my own individual practice with them, but also through the staff that I supervise. By being able to pass on those skills while also making sure they're taking care of themselves so they can take care of the clients.
Wow. So with that, are there any empowering pieces of advice that you would give for someone looking to go into your field? This can include questions asked, on the job, prior to employment, questions. And I guess for that, these empowering advice, it'd be whatever that you still have as a spark and you continue to have that drives you through with that passion that you have today.
Yeah, so I would say the number one thing entering the field is making sure that you are taking care of yourself physically, mentally, and emotionally. A lot of the issues that mental health counselors see will oftentimes trigger their own issues with those same problems. There might be some traumas that overlap with something they've experienced, and that can definitely influence the compassion fatigue and burnout and exacerbate them. So it's important to have those healed first.
Right. And then I guess for me, what I'm getting from you is having that ability to acknowledge that that is happening to you as a provider, and knowing that there's nothing wrong with you acknowledging that that comes up, but being able to see that it comes up and to take action when you are, and to make outreach and ask for help for that. Because I guess for me, and that's one of the things about the employee wellness program that I didn't do it alone, me and the committee had put together, was being able to have that kind of support financially from an employer to see that beyond just management. Because I can definitely share on my job, and I don't know about you, I'd love to hear yours. I've felt that from management, but I honestly haven't really felt it that strongly from the employer.
Yeah. So because I am at the director level, my boss is a chief officer. Mm-hmm. And my boss is very adamant about clinicians practicing self-care, so I'm very blessed in that way. To the extremities of making sure, it's part of my responsibility to make sure that it is being done with our clinicians and with our staff.
Mm-hmm. Almost in a way auditing. I feel like it's a new form of auditing, or I would love for it to be a new form of auditing. So not only are the practitioners having to audit things for patients and overall quality of care, charting, all of that, but then even having the employer audit the overall wellness of their employees, because it's all full circle,
Absolutely. Yeah. And in the behavioral health field, the ACA Code of Ethics actually states that we are required to be mindful of when we are physically or mentally not capable of providing services. And that includes being cognizant of compassion fatigue and burnout. And we're also required to look out after each other when we notice those signs for each other.
And not feel threatened when somebody, and I think that's an environment to create a willingness and a safety to be able to know that someone can speak up and let you know that, and not be offended, not be hurt, and that's for each individual person to take and work on, and sharpen, because that's a discipline in and of itself beyond your own practice, to be able to accept that. Go ahead. Yeah.
Really, we have to be able to create a safe space for having difficult conversations. In the healthcare field in general, because we will have to have difficult conversations with each other, like, hey, you're burning out.
Yeah, and there's nothing wrong here. We have applicable, at least what we have now, and then what we can also create and generate as our own generationally. Because I think I read a post a couple days ago, and it said, you may be up for having a mental health day yourself, but your grandfather or your grandmother didn't take one. They didn't have those days. They didn't want to take them, or they didn't even want to acknowledge the overall I guess for me, how do I really want to say it? That there's nothing wrong with wanting to take one. That's mainly what I'm getting from it. People call off when they're sick. They call off when they get a flat tire. They call off when their credit card or their debit card doesn't go through because then they can't pay their bills for whatever else. So they call off because whatever else becomes a higher priority. And I guess being able to have that support from your employer to know from them literally saying to you, there's nothing wrong here, instead of, that's strike one, that's strike two, that's strike three, you're out now. And I feel, honestly, that's old school. That's the way things used to be. And I think generationally, the generation before me, because I know within my last assignment, I worked with probably 2 other generations. One about to retire, one right above me, probably I'd say 5 or 10 years ahead of my career, and then my own. And then there's even been a fourth, the ones who were new grads, even under me, that I would have to train too. And I feel that the 2 other generations, and it's not to be like the song by The Who, talking about my generation, but like it is. It'd be nice to literally be able to have that safe space to have that conversation, because I'll tell you what, personally, I have friends, I have family like anybody else, and I want them to be able to have that comfort to know that they can even go up to their employer and go, I matter. Because if I don't matter what it is you want me to do, honestly, and you're right, through fatigue, and whether they say it verbally or not, what they're doing then, in a way, from actions versus knowledge and word, they're showing it doesn't matter and they don't matter. And that goes full circle for the patient and their loved ones too.
Absolutely. If the staff taking care of them don't matter, then neither do the clients, because they're suffering.
Yeah.
Because of the burnout.
Wow. So I guess for me, and I appreciate you being a guest, is there anything else you'd like to share or shout out or anything? Because I'd love to have you back on, Billy, if you'd love to come back too.
Absolutely. And I don't have any shout outs. The biggest thing though, I would say, is making sure that everyone is practicing self-care when you're in the health field. When we think about when something's wrong with a computer, right, and you have to call IT, what's the first thing they tell you to do? They tell you to turn it off and back on again. And sometimes we have to feel okay just unplugging and turning off for a little bit so that we can turn back on and work at our full capacity.
Wow. And you know what's interesting that you mentioned that? I love that. You mind if I use that, by the way, in the future? Because it's so true.
Absolutely.
It's amazing when you do turn the device on and off, how many problems it honestly does solve. It truly does. And how much, I even done it, with a cell phone or a watch or whatever it may be. It could even be a pedometer if you still have one from early 2000 or the 90s, taking the battery out, putting it back in, see what happens. It may reset it, but hey, that may be what you need. But, wow.
Exactly.
All right, folks, we're going to go ahead and we're approaching the close here. Did you bring your empowering quotes to really bring us back here?
I did. The empowering quote I chose was from Katie Reed. She is a author and a writer that also suffers from depression, anxiety, OCD, and borderline personality disorder. But the quote is, self-care is giving the world the best of you instead of what's left in you.
Wow. And that's by, you said Katie Reed?
Katie Reed.
Wow. And she even had her own experience to be able to share that. I gotta look her up. All right, folks. This has been episode 23. Thank you. Appreciate it. Appreciate you, Billy. Thank you.
Thank you.
Bye for now.
Bye.